and welcome to Diabetes Connections in the News. I'm Stacey Sims. Every other Friday, I bring you a short episode with the top diabetes stories and headlines happening now. In the News is brought to you by Edgepark. Simplify your diabetes journey with Edgepark. Our top story this week, some big CGM news. Dexcom announces direct-to-watch is here in the United States. That means exactly what it sounds like. You can just use an Apple Watch with a Dexcom G7 CGM. No phone is needed. Dexcom says the G7 is the only CGM system that can display glucose on multiple devices simultaneously and independently, including on a smartphone, smartwatch, receiver, or connected automated insulin delivery system. Dexcom says Apple products are built with strong privacy protections and users have control over their data in the Health app. If you like to keep track of these things, we are just over 7 years since the official announcement this was going to happen. Much more to come. I have an interview set with Dexcom, and I will be happy to pass along your questions. The FDA approved Abbott's over-the-counter CGM. It's called Lingo. This comes a couple of months after Dexcom won clearance for its Stelo over-the-counter CGM. Now, Abbott has been selling Lingo in other countries for a while now as more of a lifestyle device, not aimed at people with diabetes. They call it a consumer bio-wearable designed to help people make decisions about their overall health and wellness. Lingo is not intended for use in diagnosis, treatment, or management of a disease or medical condition. So there's no word yet on exactly what kind of app they're going to launch here in the U.S. If it will be marketed toward people with diabetes like Stelo or Libre, or just as an over-the-counter option for people who are curious about wellness. And this does seem like the exact same hardware as the Libre, but the company has not confirmed that. New study looking at the use of CGMs by rural children and adolescents living with type 1. Now, previous studies looking at the use of CGMs by kids relied on prescription records. But these researchers say just because somebody is prescribed a CGM doesn't mean they use one. So they looked at use of devices according to billing codes. And they found a very sizable disparity. Those living in rural areas were a lot less likely to use a CGM than those in urban areas. Even after adjusting for sex, race, ethnicity, and insurance type, the use of CGM was 31% lower for kids and adolescents in small rural towns and 49% lower for those living in what they call isolated rural towns. The next step, of course, is figuring out how to eliminate the disparity. These researchers are seeking funding to design an intervention that uses telemedicine and partners with a network of clinics in their area, they are in Kansas, to deliver specialty care to diabetes patients in rural areas. Metformin is just as safe to use during pregnancy to treat type 2 diabetes as insulin. This study, which hasn't been published yet in a peer-reviewed journal, tracked health data and potential long-term side effects of using metformin during pregnancy for up to 11 years postpartum. It's worth noting that the popular GLP-1 medications like Ozempic are not approved for use during pregnancy yet, but metformin and insulin have been used during pregnancy for decades. Once weekly basal insulin is a no-go from an FDA advisory panel. They found the potential benefits don't weigh the increased risk for hypoglycemia in people with type 1 diabetes. We have been following this for a long time. This is insulin icodec from Novo Nordisk. Most of the trials here have been in people with type 2. There haven't seemed to be any concerns about safety in those trials, but the type 1 trial found a significant increase in serious or severe low blood sugars. However, none of these events resulted in discontinuation of the treatment or people withdrawing from the study. This doesn't mean the FDA still can't approve the drug. The panel mentioned that they hope the FDA will work with Novo Nordisk to, quote, make sure if this is approved, there are as many guardrails as possible to make sure we don't harm people with type 1 diabetes. The shortage of Ozempic and Mounjaro continues, with some doctors offering advice of what to do if you can't fill your prescription. And the healthcare company Ro recently launched a public crowdsourced shortage tracker to help patients. The company says they also share the patient-reported shortages to the FDA. In this article, doctors say some patients could talk to their doctor about off-label use of other medications like Trulicity, depending on their pre-existing conditions. They may also consider trying compounded semaglutide, but compounded drugs are made to order in local pharmacy, but there is a lot of caution here. Those compounds are not regulated by the FDA, and in fact, several states have banned them. Bottom line is, if you're having trouble getting your medication, talk to your doctor about maybe how to taper off and then how to taper back on once you get it back. Stopping and starting suddenly, these doctors say, can be uncomfortable and possibly dangerous. Android users, heads up, the FDA has approved a hybrid closed-loop insulin delivery Android app. CamDiab revealed that their CamAPS FX had received approval in May. CamAPS FX is approved for people with type 1 who are 2 years of age or older, including those who are pregnant. It works with Freestyle Libre 3 and the Dexcom G6. And this is a system compatible with the Ypsomed MyLife Ypso pump. The app and those pumps are already approved in several other countries. You may recall that the Ypso pump had a partnership with Lilly to bring that pump to the U.S. The deal died in 2022. Ypsomed is still moving forward to get FDA approval for their pump. Prescription drugs for metabolic disease now make up nearly 1/4 of total national pharmaceutical spending, according to a new study, and it is driven by payments for diabetes treatments. The detailed examination of a decade's worth of U.S. drug spending also found changes in who pays for the medicine, with an overall drop in out-of-pocket costs, except for the metabolic disease category. Annual U.S. spending on diabetes medications surged from $27.2 billion in 2011 to $89.2 billion in 2020. The total annual pharmaceutical spending rose at a far slower rate during that same time. This is not being fueled by GLP-1s. Much of the persistent gain in the cost of diabetes treatments in this period was due to insulin. The number of people aged over 16 with insulin-dependent diabetes and eating disorder symptoms is as high as 1 in 4. This was a study in Finland. These researchers say understanding the extent of the issue is the first step in developing treatment pathways. They say Finland does not have care pathways for people with diabetes and eating disorders together. Of course, neither does the U.S. Typical eating disorder symptoms include restricting food intake, binge eating, insulin omission, which is when individuals restrict or skip insulin doses, fearing that they will put on weight. The prevalence of eating disorder symptoms higher in women than in men, and the age of the individual not found to be a factor. Eating disorders occurred regardless of age. Back to the news in just a minute, but first, Diabetes Connections in the News is brought to you by Edgepark. And if you're managing life with diabetes, Edgepark is here to support you on your health journey. Discover convenience and peace of mind with Edgepark, the trusted supplier in diabetes management supplies. Edgepark has a wide variety of pump and CGM solutions from top brands to fit your unique needs. Plus, Edgepark works with most insurance companies and handles the paperwork to navigate insurance complexities for you and make the ordering process as seamless as possible. You work hard to manage your diabetes. Let Edgepark take care of the rest. Go to diabetes-connections.com and click on the Edgepark logo. Now, back to the news. And it's big news from JDRF. They have changed their name to Breakthrough T1D. Here's the statement. Breakthrough T1D was selected following a rigorous data-informed process because it more accurately conveys the nonprofit's ability to connect with and work on behalf of the entire type 1 diabetes community. This makes sense, dropping the juvenile label. The median age for a person living with type 1 is 37 years. Only about 1 in 5 are under the age of 20. 1 in 5 is over 65 years old. The organization was founded in 1970 by parents of children with type 1. It was originally called Juvenile Diabetes Foundation. The research part was added later. We're going to have a lot more on this next week. In fact, our next episode is an interview with JDRF. With Breakthrough T1D. It's going to take a little while to get used to that. And finally, congratulations to Kate Farnsworth, who recently won a Diabetes Action Canada Catalyst for Change Award. Many of you know Kate from the early DIY days. I think she was one of the first in-person guests on this show. She got involved when her daughter Sydney was diagnosed with type 1 at the age of 8, had a background in information technology and graphic design, and is very well known. Remember this? She lent her skill set to developing those watch faces for remote monitoring used by DIY patients worldwide. Diabetes Action Canada says Kate has created an online patient-driven support community for people who are exploring DIY closed-loop solutions and continues to advocate for all people with diabetes to have access to the very best tools to manage their diabetes. Very nice to see this award go to someone very well-deserved. Congratulations to Kate, and thank you for all you have done for the diabetes community. Thank you for joining me. We've got some great episodes coming up. As I said, we're going to be talking about the name change for JDRF. Why did this happen? What else are they changing? Is it just a name change? You had a lot of questions about this, so that is coming up on Tuesday on Diabetes Connections. Diabetes Connections Type 2. We're going to be talking about the new field of diabetology and what the heck that means and why you'll want to know about it, how it really could help, especially if you're only able to see a general practitioner and not an endocrinologist. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.